I do have an the asshole. Okay. Let me see. Okay, let me just post.
From your experience.
Oh, from my experience.
Yeah.
Am I the asshole from my experience?
Yes.
Yes, actually, I do have one.
Wow, you're surprised.
Yes, I'm
I
surprised.
also thought you took a while to.
Okay, so yesterday I saw a patient. I'll paint the picture first, and then this is a real am I the asshole one because she keep coughing. Jeez, when are you going to die or get better?
And just for that, I will live longer. You bitch. Okay?
You've already surprised your mom. Keep surprising us all.
I know, right? I'm sure she's like any day now.
Okay, so yesterday I got a patient, 23 years old, by the way. You know what?
Oh, that's young.
Sorry,
Too old for you.
So 20. No, you listen, then you understand why I stopped when you said that young. Like,
Yeah.
okay. So this 23-year-old patient comes in. Main complaint is I've got pain in my gums. Cool. Got pain in my gums. All right. So I asked, has X-ray been taken just because I want to identify if it's a periodontal problem, if it's in a bone, or if it's a generalized problem. But before that, I asked her, are you pregnant, allergic to anything? Just the general medical question, just to get everything right. And then everything clear, good. Then I go, okay, intraoral, let's see what's up. Let's go inside. This girl has a 2-5 that is grossly carious, and now there is no area to hold on a tooth. She's got an abscess on that same tooth, and it is not the gum itself, but it's the broken down tooth from a 23-year-old patient that is not too young to understand that she did it to herself. When your tooth is broken, when your tooth has been giving you pain,
I felt so self-conscious. Sorry. I'll just die. It's fine. Like, I mean, I feel so prosecuted
You
and
should.
like, judged and like. It's fine.
There was a pause there.
Because I tried so hard. I love it. I'm mad. I tried so hard not to.
Okay, so let me just get to it. I just need to paint that picture first. So clear abscess on the 2-5, the premolar. And now, obviously, I need to extract it. So I inject on the buccal side. I'm going to be specific when I say the places I injected, so I'll explain again why. So I inject on the cheek area, the buccal sulcus inside there, towards the right. So I went backside of the abscess first. And then I injected on the inner area of the palatal side to inject the area of the gum so that she doesn't feel the pain when I hold the tooth. But I expected that she's going to feel something because there's an abscess. And if there's an abscess, the injection to anesthetize the area gets slightly neutralized before it reaches its target area. So we start that. After waiting 5 minutes, there was moderate or slight pain, slight discomfort. I don't remove teeth if it is uncomfortable. So then I now say, okay, I get it's because of the abscess. So we're going to just give one more injection. So remember I said I injected towards the right side of the abscess. So now I move towards the left side of the abscess on the cheek area, the buccal sulcus again, just to inject there to make sure that she is completely numbed. So now we injected front and back of this abscess area. So the thing with abscess is it is an acidic area, and that acid breaks down the local anesthetic. So now we're trying to inject left, right, increase the concentration so it actually does its job. Go in there with a needle, and then the child, 23-year-old, that's apparently too young, jumps up, moves away from the chair, moves her hand towards the needle and hits the needle, almost hitting my hand towards the needle for me to inject myself.
She's too old for that, yeah. Kids do that.
Yes. Was I?
You're very upset.
I was completely.
Very upset. I've also like.
I told her to sit down. That I'll have to inject because you don't have a choice. I have to inject or you go home. Because in this case, prayers won't help. You literally need to inject for the thing to be numb. So after that incident, I just left the room and then I went out of the room because of frustration, obviously, because this person had frustrated me. I came back, I injected her, I spoke to her to inform her why. She comes, presents her problem to the dentist, who has to obviously inject to sort the problem. So now you have to take responsibility for what you have caused yourself. You have caused yourself to have an infection. You're a 23-year-old individual who had a decayed tooth that, let us note, decay does not happen in a month. And the extent of this decay that had also been present in the mouth most likely has been a few years because the tooth was broken down. So if you have been walking around with this, you present to the dental practice now for assistance and you behave like a child throwing a tantrum. What do you expect? So anyways, the question is, am I the asshole for almost losing my shit because this 23-year-old almost made me inject herself? Almost made me inject myself while trying to assist her.
Did you give her a scolding?
Yes, I did.
I usually do so. Was there a finger?
No, there was no finger, but there was the needle. No, there was no.
What did you say? Play devil's advocate. May I?
Yes.
Okay, I'm not gonna play devil's advocate because I've been there as well. But like, just to, if you're going to put this out, just to explain to people why we lose our shit when we do that, it's because it's very dangerous. Like, it's an open, uncapped needle that has been in your mouth. Lord knows what you have, and then if it injects me, then I have to go and prep. That's not fun. Or I can injure my eye, or you can injure yourself, and so that's why dentists lose their cool when you do this when they're injecting you. Rather just put up your hand or knock it out, man. She's 23 years old. She's been through it.
Just to add to all this, I did explain to her when she came back, or when I came back into the room.
Did say that why?
Yeah, I explained that the injection itself is most likely going to be more painful and have to give extra because she has presented with an abscess. I also informed her that she does not have to sit on the chair if she's in that much pain or discomfort. We can give her medication, she can leave and come back later. So options were given to her. But throughout the conversation, she behaved like such a spoiled child where I said, look at me when I speak to you, eye contact is necessary. I want to know that you're understanding what I'm saying versus just I'm speaking to the wall or the air. I would escort you out of my practice. I would not tolerate that from anyone. But as we were speaking on, then at least she was looking at me because she was understanding that she was completely in the wrong, bringing your problem to somebody else's house, somebody trying to assist you, and then you're now being this kind of state that you are. At least that was understood.
Yeah, but like because I know if you're gonna put this out, a lot of people are gonna be like, yeah, but nobody forced you to be a healthcare worker. But then the thing is, you have to.
Healthcare workers are also human beings. First of all,
also human beings,
yeah.
And as cold and as callous as it might sound, don't make a you problem an us problem or me problem. You know what I mean? Because now I'm trying to do my side of things, so you have to meet me halfway. It's very, we can't baby everyone. There are cases where you can see that maybe they need a little bit more TLC, but I mean, at some point in time, you need to just meet your healthcare worker halfway. Uh, Try to make their job as easy as possible, because if you can make my job as easy as possible, then I can make this experience for you as painless and as not as non-traumatic as untraumatic as possible. And we can all work together, because now you're gonna come here and then you're gonna have a stank attitude, and then you're gonna make your problems my problems, and you expect me to just no, that's not how it is. It's yeah. We have to work together.